Alrighty, so here's all about our forms. This is our boarding form. This is not necessarily always used for anesthesia, but it is something if a patient is getting any sort of surgery while they're boarding or anything like that, we do have them fill out. It just has basic information about them, if they're getting stuff while they're here, what kind of food they eat, if they need anything, as well as owner's permission to do stuff while they're here boarding. Our next form is going to be our surgery consent form. We will have the owner's and pet's names, our procedure that we're doing, and then we do require blood work. Now if the pet has previously had blood work or the owner declines, they would mark that here. We do have the owner initial if they're aware of costs, that they're at risk with anesthesia. We do have them let us know if they do or do not want life-saving procedures to be formed. If we need to have an emergency contact, we have them do this here, as well as a contact to call as soon as the pet is awake from surgery, and their signature in the day of the surgery. With that, we will go over our estimate. Here's an example of one here. This pet is going to get spayed. We have our pre-surgical blood work that we generally do on all patients. Our spay for that weight range and any color to go home. We'll have the owner initial that just so that they are aware of the cost going into the procedure. And then for most of our other paperwork, we are going to have a anesthesia form filled out that the doctor will fill out. We fill out the patient's name, their temperature, date, weight, and what kind of surgery they're getting, what doctor they're here for. Any sort of preoperative, anything, radiograph, blood work, we'll write that in what kind they're getting here. This is going to be the type of anesthesia that the doctor is going to use, and this is going to be what we reference for when we induct the patient with anesthesia. These are also the injections of medications that they're going to give during the procedure, as well as our post-pain and go-home medications. On the back here is where we log all of our drugs, as seen in where we monitor the patient and everything that we log, as seen as in me earlier in the film. We've got all of our information here. This is the amount of anesthesia that we're using. The type is right here, ISO, our size of tube, and we are using a heating pad. This is the fluid information here, what our rate is, our total, where we've got our IV catheter at, and what kind of fluids we have. During the procedure, we do monitor our SpO2, heart rate, respiratory rate, blood pressure, our circulatory reaction time, temperature, jaw tone, and eye position. We do have our start of time and our end time of surgery, as well as the doctor and technician doing the surgery and our length of the procedure. When we do our blood work, it generally pops out like this. We have 2 in-house IDEX machines. So this patient just had a little bit of high basophils in their CBC. Everything else is within normal limits. And as well as to go with all of their stuff, we have a check-in sheet for every patient that comes in that details all of their information. We do have cautions on them, such as this patient with restraint. We have that noted here, as well as any sort of anesthesia or blood work cautions. She's current on all of her vaccinations, and we also have the owner's information here. Another type of paperwork that we might have in the clinic would be our hospitalization form. In here, we would fill out the date, patient, client, body weight, and our presenting complaint or diagnosis. Here we would fill out our phone number, our breed, doctor, and patient number, and also our diagnosis. Throughout here, there are temperature, respiratory rate, pulse rate, our cardiac rhythm, circulatory reaction time, our skin color, oxygen level, oxygen delivery, body weight, our SpO2, blood pressure, lab work, anything that we're doing, and then also just to monitor the patient, what kind of food we're going to give, when we're going to give it, urination, defecation, giving water, appetite, IV fluids, and the doctors will list their medications and highlight where they'd like to give us throughout the day. Our postoperative care instructions are right here. We do generally highlight the most important parts, which would be restriction of activity, no jumping, stair climbing, playing with other pets, or roughhousing, peeing on a short leash and returned indoors immediately if we're going outside, or being left in a small area or kennel during our recovery period. It's also important for us to let the client know if their patient had intradermal or skin sutures, because our skin sutures do need to be removed in about 12 to 14 days. Intradermal will just go away on their own. Most all of our surgery patients will have an e-collar. These are our lab work forms here. This is for our biopsies. We use Antech Diagnostic Laboratories. And this is for any other sort of blood work that we're sending out. We fill out patient name in both of these and what kind of information we have to give to our outside lab. And especially here, it's most important for the doctor to fill out the patient history and where the tumor was removed, as well as any special notes that they have. So here we have a cage card. This is how we identify the patient and what kind of surgery they're getting. Today, Bridget will be getting a spay done. If they were here for monitoring, vaccines, or anything like that, it'll be written here with their name on this card. And also where we double check that is we're gonna write them on our whiteboard here. And with Bridget, we've got her box for her preoperative medications, her spay procedure. We're gonna have the doctor call the owner, and then we're gonna give her her injection. From there, we'll write on there when we're gonna feed her and walk her this afternoon, as well as the doctor will let us know what time she's gonna be ready to go. Now we're gonna demonstrate getting a dog out of a kennel. I'm gonna make sure that you've got a decent amount of leash here. Get it wrapped around their head and have them walk out. When you're getting a cat out of a kennel, you obviously wanna make sure they don't jump. And you want to scruff them, bring them to you, and shut the kennel. All right. When holding for blood draws, you want to make sure to restrain the patient. So for a jugular vein draw, you want to have the patient sitting and hold their muzzle closed and in a steady position so that the vein access is open. For a cephalic vein, you'll want to hold their head so that they can't bite you or the person drawing, and you'll place a sturdy finger behind the elbow, as well as roll the vein to the side so it pops up there. For our lateral saphenous vein, you'll have your patient lay down. Make sure to watch their head when you do this. And you will hold off this vein right here so that it pumps up right there for the person. Muzzle on a patient. You want to make sure that you do have control of them. So we're going to make her sit right here. And then you just slide the muzzle on like this and secure it. From the back. And then you do want to make sure that they don't paw their eyes or try to pull it off. Biddy here is our clinic cat. We're going to do a physical exam on her. So her ears look pretty clean. Whites of our eyes are good. No dental tartar. And her reflex time is normal. Abdomen is nice and soft. Now, Biddy only has 3 legs, so we got one missing here from when she was younger. Go ahead and listen to her heart and lungs here. And our heart rate is about 160 right now. Biddy is a little bit of a nervous girl when she gets back here in our treatment area. All right. I know. Go ahead and get a temperature on her. I know, Biddy. All right, our temperature is going to be 99.9, which is pretty typical. And we weighed her earlier. She was 8.4 pounds. And I would give her an ASA grade of 1 because she is healthy and there are no concerns with her. If we were to do any further testing on her, if her heart sounded abnormal or lung sounds were abnormal, we would do some x-rays. If she was having any tensness in her abdomen, we would probably do some blood work, see what's going on. She is about 8 years old, so senior blood work isn't a bad idea either way. But right now she has no symptoms, no abnormalities at home, and she is normal upon physical exam.
I remember. Slowly but surely, I remember.
Alright. Now we're going to draw blood from the jugular vein. Go down just a little bit. Alrighty. So I can feel the vein, so I'm going to go ahead and poke. There we go. Now we're going to pull from our cephalic vein. Make sure that I feel it right there. I'm going to put my thumb there for security. There we go. Okay, for our lateral saphenous vein, we're going to spray the alcohol right here. Feel for our vein. I'm going to put my thumb there to brace it. And then we'll hold up for our blood.
Fine, don't move, okay? Don't move. Good boy. Good boy. No, can't move. No. Good boy. Ah!
And that'll be enough for us in here. Now with most of our patients, we're able to open the client, look at all of their information, and look at the patient's information as well. Now for our laboratory, we do have an online way of getting lab orders. We can type in our test code, print it, and then the lab results will show up here in this section that we can import into our system. This also gives us a history of since we've been seeing the patient, and if the patient brings in any outside records. We have weight history down here, as well as our previous RXs, and then owner's information as well as other pets information there. And then you can also look up this patient and pet in the system without them having an appointment. Another one of our systems is going to be our in-house laboratory machines. We have multiple. We have our urine strip reader right here. This is going to be our computer that will connect to our chemistry reader, CBC reader, as well as our centrifusion here. We enter in the patient's information, and then it prints out into the form as shown earlier, and then we can hand put it into our computer system. These are all IDEX in-house equipment that we have, and all of our outside equipment is through Antec. If abnormalities are found on a physical exam, some laboratory testing might be recommended. As shown earlier, we have some in-house laboratory equipment so we can run chemistries as well as complete blood counts. With this patient here, the patient was pretty anemic and looked anemic upon the exam, as well as very lethargic. And as it shows, she's got a very poor CBC. The only elevation she has in her chemistry is a little bit of a BUN elevation. Her red blood cell count is about 1,600. Her hematocrit is 12.9. So she's not in very good shape. Whereas this patient is having general anesthetic blood work done prior to our procedure. The abnormalities found in his CBC, none found in his chemistry, would be his NCH, MCV, and RDW. None of those are worrisome that would need any further testing other than that. Other testings that we could do would be echocardiograms as well as abdominal ultrasounds. We also have our X-ray machine here for any abnormalities found within our lungs when listening or our heart. Additional tests that we can run to our outside lab would include biopsies, again running the CBCs or the chemistries, as well as thyroid, urinalysis panels, and so forth. And we can also run those in-house. Sometimes if the patient isn't in critical need, we do send them to our out-house lab, and those would be generally our most common additional procedures that would be. For postoperative care and preoperative care, what we do is run our pre-surgical blood work. We have a pain injection before the procedure, as well as our anesthesia to get the patient nice and comfortable. And then also in the middle of the procedure, we'll have another pain injection, such as our Rimadyl. After the procedure, we're going to send home a couple of different pain medications for Tramadol and Vetprofen. This will help the patient just to stay in a nice pain-free zone. Alright, so we're going to do a controlled substance log. We're going to put the date that it's here, the patient's name. And then you want to add their address where it says the address. And then in our log, we do put a reason why we're sending this medication, the quantity that we have, and then our new balance, which you will want a calculator to calculate. And that's going to be $12.25 left over for us. You put your initials, and that's a controlled substance log. Different parts of the anesthesia machine. This is our oxygen flow meter. This determines how much oxygen we're giving to the patient via our tubes. This is going to be our pressure gauge right here to know how much of the sedative is going into the patient. This is our flush for whenever we need to flush the oxygen from the system. This is our sevoflurane and isoflurane vaporizers. You can see the fill line right here. And this allows the anesthesia to actually vaporize and become the gas anesthesia that it needs to be. This is our inspiratory valve, which allows all the gases that are going to the patient to flow through here. And as the patient exhales, this is our expiratory valve. And the carbon dioxide will go into our soda lime absorber here, and then our etheric canister will collect the additional or already used anesthetic gases. This is our breathing tube that allows the patient to hook up to our endotracheal tube and gets their anesthesia from there. Our pop-off valve is right here. When this is closed, this builds pressure, allowing you to do your leak test or to give the patient anesthesia. You never want to leave this off, as the building up with the pressure can cause the patient not to be able to exhale. When it's open, the pressure is relieved and the patient is able to breathe normally. This is our reservoir bag right here, where this will fill up as the patient is breathing, as well as when we turn on our oxygen and anesthesia and shut our pop-off valve. This is an E-tank gas anesthesia machine. Here we have our gas tank, our oxygen tank, and our oxygen pressure meter. And then for our non-rebreathing system, we've got our etheric canister connected here, as well as this is going to be your pop-off valve by an open and close valve that you can open and close for the patient. And then this will be connected right here for inspiratory purposes. And now we're going to demonstrate a leak test. We're going to turn on our oxygen, turn it up, and turn on our anesthesia as we've got our thumb over the end of our breathing tube. And then you're going to shut off the pop-off valve and allow us to build up some pressure here. Then we'll open our valve. Make sure that our pressure gauge is not lowering, which our leak test is good. So then we'll release the pressure and release it from the bag. Other parts of the anesthesia machine that you would use are your oxygen mask and your induction chamber. For your oxygen mask, you're going to connect it to your breathing tube here, and you want to judge it on the size of the patient's muzzle so that no extra gases are released. If you're going to use your induction chamber right here, generally for anesthetizing cats, you're going to hook each end up here to the inspiratory and expiratory valves while the anesthesia is put into the patient. All the materials you'll need to get ready for an anesthetic procedure would be your anesthesia machine. You're going to need your endotracheal tubes, and on this tube is the one that I am going to use for our cat. It's already got our ties on so that the tube will stay in place during the procedure and while the pet's anesthetized. This is our laryngoscope to help us put in the endotracheal tube during intubation. We also have our pulse oximeter, and once we get the pet underneath the anesthesia, we do want to have this ready to go ahead and put on them, know that they're oxygenating well before we continue with anything else. And then right here we've got a small towel as a gurney for our cat. When looking to prepare for your procedure, you do want to take your cuff and have it inflated and check that there's no leaks in both this one, and then generally have a backup in case that size isn't correct that you've measured. Check both of these.
Yeah, so I just want to make sure.
When measuring a patient for an endotracheal tube, you want to measure the length from their nose to their shoulder. Make sure that the tube isn't going to be too long, pushing down towards here or pushing too far out towards here. This tube is going to be a little bit too long for her as her mouth ends back here. You can also measure the width by looking at their nose. This one is the width of her nose right there. And this one is going to be just a little bit too big for her, so we're going to use the size 3 trach tube for her.
For my cephalic catheter in a dog, I'm going to go ahead and shave the area and spread the patient. And then I'm going to go ahead and get my catheter out, and once it's already been pre-flushed, I'm going to insert it into the patient's leg.
It's Chica. Oh, it is Chica.
Once I get my flash, I'm going to go ahead and feed the catheter into the vein, and then I'm going to grab my cap and go ahead and secure it in there. We're going to go ahead and tape this in so it doesn't move out of place. Once we're securely taped, I'm going to go ahead and grab my flush and flush to make sure that it's in the vein and it's working correctly so that the medication can get where it needs to. And our catheter is all good here. So then I'm going to finish up with my last piece of tape and then go ahead and put the bandage on.
Got a little low there, sorry, Emily. Alright. Now we'll do a pre-scrub for the catheter.
He had surgery, so we just need to make sure that she is careful. We did that. Yeah. So we just have to make sure she has to be good.
One more scrub here. We're going to put our catheter in that we've already pre-flushed. We see our flash, so we're going to feed. We'll put our catheter cap on. And tape in. we'll flush the catheter to make sure that it's in the vein, which it is. We'll wrap it with our vet wrap. And that will complete our saphenous catheter.
We're going to do our induction medications, which Dr. Crawford has listed out on our surgery sheet. Right now I'm going to mix ketamine and midazolam in a syringe. Our empty syringe back here. Make sure there are no air bubbles. We're going to give this intravenously. Now we're going to flush our medication. I'm going to go ahead and turn on the oxygen. Alright, now I'm going to give pelvic flow so we can intubate. Grab my endoscope and tube, which I've already checked to make sure there are no holes.
Smells weird back here.
Half the dose right now. Flush that through. Alright, now we're going to intubate.
So now we're gonna use our laryngoscope down at bodice right here, right into our trachea.
Taking back up.
We're gonna wait on the lab one, so I got everything else in.
I'm going to give this Rimadyl subcutaneously. I'm going to pick up the skin, push in, pull back, and then make sure it's not in any muscle or blood.
For an IM injection, you want to go ahead and insert into the muscle, pull back so you don't have any blood or anything in your syringe, and then inject the medication into the muscle, and then pull out slowly.
Okay.
Well, maybe it's all that genetic, like trying to figure out how the medicine is. I know you said it's so super complicated. It is complicated. It's just like it's hormonal or not. I don't know. Yeah, I think they let my mom have anything off. Well, yeah, they leave it off, but still, doesn't mean like they get rid of it. It only takes 6 hours and 20 minutes to actually do it. But I'm going to talk to the guy and get off that and have the day. And this is like waiting at the MRI. Yeah. And all my friends have done good. That's only like, I thought, 3 or 4. Yeah, I don't remember. But yeah, that's crazy. That's a lot. I'm just getting rid of this one. But is this one? Is this that one? We still had the circle of lymph node that was in the from the store. Not what they perceive. Guys, in the past,
No, you can do it. All right. Get all our excess hair here. Dr. Crawford, do you want to come check my shave, make sure that's good for you? Okay, now we're going to do a scrub outside of the surgery room.
Yeah, before, awesome. Oh, it's one before, sorry. Yeah.
One order of syrup, if we can, there is and then 3 orders of red serum separated tubes.
Yes.
And 1 order of serum. This is the daughter, this next one, and that's gonna be it. Okay. Well, thank you. There's the mom, so that's Adrian. Anyway, he wants to. So that's where the confusion happened. So we're here now, and I'm gonna
Now we're going to use our ties to tie the surgery patient gowns. Do it fly off the table.
That's a pretty good one.
I'm going to get his thermometer in before I tie on his back legs. Oh, thank you.
Just FYI, just get it up here. It's not good to use these for blood. Just if there was only the only one you use. Yeah, just make sure if you do have to use this one that you watch it.
In the surgery room. Alright, that's our surgery scrub.
For CPR in a patient, in a non-rebreathing system, you'll close off the valve, squeeze the bag, and watch our pressure gauge to make sure that we don't hurt the lungs. In a rebreathing system, you will squeeze the bag again and also close off the valve and check our pressure to make sure we're not inflating too much. And in between each of these, you will do chest compressions on the patient until their heartbeat is at a normal rhythm.
Monitor here. We've got our EKG, our respiratory rate. This is where our pulse will show, SpO2, blood pressure will show up here, as well as temperature and our respiratory rate that it's given us. This is our thermometer probe. It's going to be our little tongue probe here that'll tell us our heart rate and SpO2. And all 3 of these will help give us our EKG readings and respiratory readings. If any of these are disconnected or not sprayed with alcohol on the skin, then they could give you misinterpretations. And then this is going to be our blood pressure cuff here. You'll wrap it around the patient and press start. It'll fill up and give you both your high, low, and median numbers. This is our fluid pump that we have here. We do have surgery fluids for each patient, and then we'll enter in whatever the doctor recommends for their maintenance dose, which is generally double the body weight, for an hour long, and then we'll decrease it by half if our surgery is longer than monitoring our patient. We are monitoring our SpO2 level right here. Our ECG is telling us our pulse, got our blood pressure and our respiratory rate, as well as our heart rate or our temperature. These are all connected to him in different little tabs that we have here. We also have his fluids going on our machine, and I've got his anesthesia machine where I can see it and reach at any time. We record these at an interval of 5 minutes. And then on my chart here, I will start recording. Check our gums, our eye position. It's been 5 minutes, so we're going to take our next reading, monitor our heart rate, SpO2, blood pressure, our gums, jaw tone, respiratory rate, monitor it all.
How's our blood pressure?
It's at 103 right now.
Go him up on 3.
And we're ready next check. Our heart rate's staying pretty in the 70s, 80s. SpO2 is really good. We're at 114 right now. Blood pressure.
Medium, okay. Large, it kind of presses on that windpipe and makes them feel like they need to cough as well. So just, you can pick those with medication anytime. We'll do till 5:30 today, and then about 2 weeks after you start, just bring them in, we'll do a quick little blood check on them. But you should notice improvement within just the first few days on the medication, okay? Yeah, sure. We look at the green right there. This, yeah. So this is a month's worth of medication for him, and it comes to $98.40. Are you a senior citizen? Okay, when you come in to check out, just let them know, and they can do a 10% discount for you. We do that for senior citizens. They can put that in, so that would save you about another $90 or so. So if you want to, my new ball was all I've ever had. I'm like, oh God. I don't have that. I don't have a lot of money. I figured it was really good. Yeah, I figured you were I wonder if he passed or she did it at home. Yeah.
She wants more drugs or something.
She doesn't want to use it.
She doesn't sound like she wants to do that. She wants to make him comfortable.
What else did we already give her? Sucks.
Dr. Crawford, is
Yeah.
Nugget a new heart patient?
Yes.
That's what you were just talking about?
Yeah. And it says she's a senior citizen, so once she showed us, I don't know if you only proof or whatever that is, we can put that in it. Put that on my lead.
I was gonna cut her pills for her the first
Yeah, that
time,
sounds great.
and then let her know in the future.
Yeah, buy that $2 pill cover.
Dr. Crawford, J.C. Rockley's owner's on the phone.
She was on the phone.
Or she's gonna call back, okay.
What does she
I
get?
guess she can't make the decision to euthanize, so she wants to do whatever she can to make him more comfortable.
Okay, let's find out what exactly symptoms he's having. If it's pain, we could do something for that.
Right, because I didn't see that he's had tramadol or anything like
Yeah,
that.
for next. If it's coughing though, I'm kind of out of, we could try hydrocodone, but I don't know if that's gonna help him. Open it up first.
You're so sharp.
Yeah, me too. I forgot how to do all this stuff. I hate going a while.
What's that?
Bigger one?
Flip.
Straight one's fine.
This one or that one?
Oh my God, he's the nicest at my house, and I haven't gotten any calls.
Responsibilities of a sterile technician are to maintain a sterile field at all time. The technician really needs to hand the instruments to the surgeon as asked for, as well as be able to care for the exposed tissues by blotting or moistening the tissues that are needed. To maintain an asepsis surgery room, the technician really needs to make sure to have their hands up and elbows above their waist, and this will help prevent you from having your hands falling down and hitting below your waistline, which is considered a non-sterile area. This will also help if instruments are handed to you, you need to make sure to grab them from inside instead of grabbing the entire package, because outside of the package is not sterile. So let's pay attention to things like that. If something happens where the sterility of the surgery room is in question, you need to notify the surgeon immediately. That way it can be addressed and the problem is solved before something happens, such as an infection is passed on to the patient. All of our instruments here, take our deal off, lean this down here,
attached to the patient to monitor respiratory rate, heart rate, ECG, all of that fun stuff. We'll want to go ahead and wrap these up so it's easier for the next person to get in here. These are clean and wrapped up. We can put them in here. Pulse ups, monitors, our heart rate also. Thermometer probe. Use our forehead settings to square down in here.
Business or not? Whichever one I think here. Okay, so she says, that's awesome. Oh my gosh, yes. So yeah, I'm be so excited. Again, this is a good one. Okay.
Go to database.
Mm-hmm. Yeah. Okay. So there's her ears up. Okay. And then Mr. Bismuth.
So we're stuff all our trash from surgery. Dump out. We'll just wipe this out. And set it back to So we're cleaning our surgery instruments. Get all in there. Clean. We'll rinse off in some water. Dip it in our instrument milk. And we'll lay it out here.
Call and get around. You want to choke it up. So usually I take a picture with my cell phone and then just send it to agency.
Okay, that's probably good. I'm gonna put our scissors on there first. I've got them categorized by instrument and size. And then we're gonna put our tissue clamps on here. Go ahead and get our curved hemostats, our regular hemostats.
Got our towel clamps on here. And our needle holders. We'll lay them out all nice and pretty on our little hot towel here. We will place our forceps and then our needle holder and gauze right on top of that. We've got a drape for the surgery patient. And we'll go ahead and start wrapping. A little extra room so we can open it without making it become unsterile. And we'll get our autoclave tape and our masking tape. We'll put a good little strip of autoclave tape on there so we can tell that it's been sterilized. And then our masking tape to hold it together as well as to label it so that we know what pack we're getting into. Alright, and I put my date and the initials, and that's our surgery pack. Autoclave tape on here.
Yes. Okay. And all names just the vaccination.
Tape to label.
Oh. Okay. And what is the fax number? Is this your personal fax or am I faxing it to the agreement place? It's to you. Okay. All right. I'll get those right over. Yeah, you're welcome. Oh, yeah.
Our autoclave is right here. We do have our little tray here that holds all of our surgery packs and gowns. Now these have not been done. You can tell by the autoclave tape as it does not change colors. When doing your autoclave, you do want to have it fill up to this line here of distilled water, and then we close it and lock it. Now to know our correct temperature for sterilization, it takes about 30 minutes to get there, and then it can stay in that temperature for about another 30 minutes. So our autoclave is generally running for about an hour. For us, we do have a little special green area here that our temperature can be between, but in case you can't read that, it's 250 to 275 degrees Fahrenheit. For our pressure, we do want our pressure to be between about 15 and 32 PSI. This will let us know that our steam and temperature are sterilizing our equipment enough for us to use them in a sterile procedure. On here, we do have our sterilize mode, fill, vent, and off. Right now it's in the off position. First you'll fill it, then we'll sterilize it once it's filled, and we'll vent it once we've come to that sterilization point to make sure that no one gets hurt from all that steam coming out, because it is very hot and can burn you. To know that a gown and pack are completely sterile, we check the autoclave tape that is darkened on both the stack and the pack and the gown after it has been autoclaved, and this lets us know that it has been done and is ready to go. To maintain and clean the autoclave, you want to clean it with some distilled water as well as a little bit of soap. And what you're going to do is you're pretty much just going to wipe down the major areas, especially the seal here, to make sure that none of the steam escapes while you're cleaning. Go ahead and pull out and wipe down the tray as well as the inside of the autoclave. On top here we have our area that we can put in our distilled water for steam, and once weekly we want to check that and make sure that it is at the level it needs to be. There's a gauge inside of here that we can judge that by. Once a month we do need to drain the water and then re-put in new distilled water. Different types of sutures that we use here is going to be our Vicryl, which is a braided suture, and it is absorbable into this skin. It's on a reverse cutting needle. This would be used for the skin, same for a conventional cutting needle. We also have our PDS, which is a monofilament, which means that it's not braided, it's just one single strand of the suture. This one is also absorbable, so you can use those for intradermal, underneath the skin sutures, or even inside the pet. But inside the pet you would want to use a tapering needle for organs, hollow organs. This is a silk suture. It is braided, and this one is also on a reverse cutting needle. This is the only natural suture that we have here, and it is also non-absorbable. This is a nylon type of suture. This one is not absorbable into the skin and is a synthetic, as well as our PDS and Vicryl are synthetic. This one is a monofilament again, and it is just one suture instead of braided, and it's also on a reverse cutting needle. Different types of our suture patterns are going to be our simple continuous, which you would use underneath the skin or to close the skin there. This is going to be your forward interlocking suture, so your simple interrupted suture that you could use to close the top of the skin for external sutures. And then this is going to be your cruciate suture. There you go, starting to go around it, buddy.